What about, say, your gut or your GI tract? Are these also affected?
Yeah, these are also affected. Gut is also affected, mainly stomach is affected because of parasympathetic and sympathetic nervous system is involved, which is in early satiety. Patient is not able to eat food properly. Gastric, because of that gastric refluxes is seen. Delayed emptying of the stomach. This is the main complication. That's why patient goes in anorexia and weight loss. Second thing is gut is also involved in females, in males, urinary tract, recurrent urinary tract infections, and infections in the genital region is very common with because of any fungal or bacterial infections. The other thing in males, erectile dysfunction, retrograde ejaculation is the first sign of diabetic neuropathy, and other sign in GI tract. If we talk about alternative with constipation and diarrhea is also seen in few patients because of neuronal involvement. Patient may develop diarrhea at night and constipation during daytime because for a few hours he is not able to pass anything. So just
Are these early
alterations.
signs, or this is way later?
In between we can say, or towards the later side spectrum of the disease.